The clinical pharmacists are so important here at this clinic. They provide services to so many entities, including our patients, our providers, and the entirety of our healthcare system. So many of our patients have complex medical conditions, and I think the pharmacy component is a major component, and having clinical pharmacists here is just vital to the comprehensive care of our patients.
Speaking to the value that clinical pharmacists play here at the health clinic are many. They start with vaccines. They include diabetes education, hypertension patients, complex care coordination, patients who are on 10, 15, 20 plus meds. We're talking consultations on antibiotics and appropriate use, and infectious disease, all the way up to ADHD medications, understanding pharmacotherapy, and even down to just basic education that's non-pharmacotherapy.
The way we manage patients here at the ARUP Family Health Clinic is very team-based, and having clinical pharmacists as part of that team is absolutely vital, especially for patients that are on multiple medications or are on high-risk medications. Having a clinical pharmacist here makes the patient feel reassured, makes me feel reassured.
There's a lot of reasons why pharmacists are a good fit in this particular clinic. Most people who come to a healthcare clinic get prescribed a medication, and pharmacists are the experts in medications altogether. Pharmacotherapy, therapeutic guidelines, monitoring, patient education, side effect profiles. I mean, I look to them all the time for help in being able to understand and prescribe a correct and appropriate regimen. And I consider myself so spoiled that I have two that I get to work with. How would I like to see pharmacist's role expand here in clinic? I think to answer that, I'd like to answer what I think needs to happen on a national level. I think clinical pharmacists need to be more of an advanced practice clinician type role with their own prescribing privileges, much similar to a PA or a nurse practitioner, where they have guidelines on certain conditions that they focus in on and treat, but they should very well have the licensure and capabilities of prescribing a lot of these medications that they're monitoring, that they're the ones providing the education, they're the ones providing the monitoring. They should also be able to do the prescribing as well.
So I cannot imagine practicing without clinical pharmacists ever again. I think clinical pharmacy should be an integral part of all clinical services, primary care, specialty alike. It's just become a vital component, and I don't see being able to practice without that service in the future.
Just on a personal level, working in medicine, it's very taxing, it's very cumbersome, it's very complex, and there is a huge amount of responsibility. And I go home and sleep better every night because I have a team that I get to work with that has my back, that we collaborate and work together on. And it is nice to be able to do that with professionals like clinical pharmacists.